VET 105 Skills Video by Jennifer Middleton. Removing and transporting a feline from cage to exam room. When removing a feline from a cage, first look for signs of aggressiveness or fear. If the animal is aggressive, they probably will be towards the back of the cage with their head lowered and their hair might be raised up on their back. Wally here is laying down comfortably, facing the cage with confidence, so you know that he probably isn't going to try to be aggressive towards you. Open the cage door carefully, pick up the animal, and hold him close to your body. I like to keep one hand on the cat's scruff close to my body to have control of their head. While you're walking into the exam room, make sure that you keep that mobility of their head limited and keep their body tucked in close to you. Walk cautiously and carefully place them on the exam room. Removing a canine from his cage and walking it to an exam room. Removing a small dog from a cage is pretty similar to removing a feline. Once again, look for signs of fear or aggression. If a dog is standing with his or her head lowered with their tail tucked between their legs, they could potentially harm you due to being scared. This toy poodle, Susie, is making direct eye contact with me, has no signs of philo-erection, and her head is held high. Slowly reach into the cage and lift the dog, and once again, hold the dog close to your body with one hand on the dog's scruff to keep mobility of the head limited. Walk slowly and cautiously to the exam room and calmly place on table. Applying nylon and gauze muzzles to a canine. There are two different kinds of muzzles commonly used at my practice, nylon and gauze. When applying the nylon muzzle, always loosen it all the way first and gently apply it to the dog's nose and mouth with the right side facing upward. Snap the fastener and adjust it to fit snugly over the dog's head. When applying a gauze muzzle, crisscross the gauze over the dog's snout and wrap the ends behind the dog's ears and tie a knot. Always follow this up with applying a nylon muzzle for extra safety. Applying a nylon muzzle to a feline. The same rules apply when applying a nylon muzzle to a feline. Always make sure that the strap is completely loose so you can cover the cat's face and then readjust it to fit snugly to the feline's head. Make sure that the entire face is covered except for room on the nose to allow the feline to breathe. Wrapping a feline into a towel is what we call a kitty burrito. This is perfect for an extremely aggressive animal or one that is in pain or fearful, in order for the doctor to fully examine them and have full control of their body. Snugly wrap them up in a towel and make sure that they don't have any mobility of their limbs or head. Hold on to them so that the doctor can do a good job of examining the cat and they cannot use their paws or mouths to harm the doctor. Restraint of a patient for a physical exam as well as vaccines. The number one rule while holding an animal for the doctor to examine is to never take your eyes off of them. Watch the animal the whole time so you can be prepared if they bite the doctor, jump off the table, etc. Here, Dr. Houston is doing a physical exam on Harley, including checking his eyes and ears. Harley is getting his distemper vaccine today as well. While the doctor gives the injection, hold the animal's head away from the doctor and have a good grip under his or her belly. I always try to keep the animal close to my body and am very careful about keeping control of the animal's head. I also like to try to soothe the patient by petting and using voice reassurance. Restraint of a feline in the lateral stretch. When using the lateral stretch restraint in a feline, place your hands on the scruff and hind legs of the cat. Gently flip the cat onto his or her side and stretch their body out laterally. Once in position, place your right arm up against the cat's back so that they can't wiggle around. This restraint is used in my practice all the time on kitties when trying to obtain a sterile urine sample. When restraining small animals for jugular venipuncture, bring them to the end of the table and turn their head to a 90-degree angle. Dogs will usually stand and cats can lay down, which actually gives you better control of their paws. Always make sure that your hands aren't in the way of the jugular vein so that the doctor can easily see it. Restraint of canine and feline for cephalic venipuncture. When restraining a dog and cat for cephalic venipuncture, always have control of their head by pulling it away from the doctor or vet tech. With dogs, wrap the other arm around the middle and apply some pressure so they can't wiggle or jump back. I typically use a tourniquet on dogs and hold the vein off with my hands for cats by stretching out their leg and applying pressure to make the vein visible. When the doctor or tech is done, apply pressure to the site to avoid bleeding. Restraint of feline for femoral venipuncture. When restraining a feline for femoral venipuncture, lay them on their side using their scruff and hind legs just like when doing the lateral stretch. Stretch out their bottom hind leg and use one arm to apply pressure, making the vein visible. Skeeter, the brown tabby, didn't want to stretch out his leg, so in this video, a veterinary technician, Aisha, helped by stretching his leg out so I could apply pressure without releasing him. Restraint of a canine for saphenous venipuncture. When restraining a canine for saphenous venipuncture, I tend to hold them on the floor if they're a large dog and put them on the table if they're a smaller one. This is Emma, Dr. Houston's pointer, who does a really good job of standing still, so instead of using a tourniquet, I've decided to hold off the vein with my hands. Have a good grip around the dog's neck, holding their head close to your chest, and then as you see that I'm doing here, hold off the vein in the back leg so that it's visible for the one drawing blood. Afterwards, pinch off the vein to prevent any additional bleeding. When scanning a patient for a microchip, turn on the scanner and slowly roll it down the back of the animal's neck until you hear a beep. You will then see a code on the microchip scanner that should match up with that patient so that if they get lost, they can easily be found. Applying a topical medication. When applying a topical medication, the first thing you want to do is make sure that where you're going to apply the medicine is clean. For example, this cat was just spayed and finally has woken up from anesthesia. Where her surgery was already cleaned and has no bacteria on it since we scrubbed her right before surgery and then cleaned her with hydrogen peroxide afterwards. Here I'm applying an anti-lick guard so that she doesn't lick at her incision site. I put it onto a Q-tip and gently hold the cat so that she's comfortable and apply it lightly to the incision so that it's enough to keep her from licking, but not so much that it gets all over and is a huge mess. Administration of a liquid medication. When giving a liquid medication, it's always best to go with the syringe to the side of the mouth, and what I like to do is apply pressure to the side of the mouth just enough so that the animal will start to open their lips, then slowly push the plunger so that they begin to lick and lick and lick and swallow. Here, it's not such a fight because my cat Wally will eat anything, so he's loving the banana-flavored Panacur. Another animal that might put up more of a fight would be easily restrained using a burrito-style towel, or maybe even having a more secure grip on the animal. Here, Wally seems to be enjoying it, so it's not like he's putting up that big of a struggle. Administration of an oral tablet. This is Puff. He's our resident house cat. He's diabetic and he tends to suffer from diarrhea from time to time, so I'm going to give him half of his metronidazole tablet today. Puff absolutely hates getting any kind of medication. He really hates when you touch his mouth. He does have really bad gums, and so I think it might be painful to pry his jaws open. So here I've decided to use the pill popper on him. He's a really good cat. He stays still, so I'm going to hold the scruff of his neck, pull his head a little bit back so that I can put the pill popper in his mouth, push the plunger, and then make sure that metronidazole goes right down by rubbing on his throat and putting a little Nutrical on his nose to lick off afterwards to make sure the pill went all the way down. A lot of times I like to use a chaser like wet canned cat food, or a syringe full of water is also a really good chaser. Administration of eye medication. When administering eye medication, keep the animal close to your body and pull down on their bottom eyelid with low pressure to keep their eye open. Squeeze the tube of ointment or eye drops slowly and apply just the amount that's needed. Make sure that you do not touch their actual eye with the applicator so that you don't hurt the actual eye. Squirt out the amount needed and then make sure that the animal blinks a couple times so that you actually got it in. Administration of a sub-Q injection. Here's Puff again, and it's time for him to get his insulin. I'm going to give him 5 units of insulin today. So what I like to do is get Puff on a higher surface, usually the treatment table. Sometimes he'll be hanging out in the office. I'll get him up on the desk. I pull back the area of loose skin. I kind of switch it up between his hip and his neck. Today I'm going to be putting it into the scruff where there's lots of loose skin. I pull up, I insert the tiny needle into the skin, I push the plunger, and then I rub on it because I know it can be a little bit painful, and then I usually send Puff on his way. Other times when I'm giving injections, of course, I would clean the area with a cotton ball first. Puff, I do every day, twice a day, and I always just usually do the scruff or, like I said, the hip. When cutting an animal's nails, I always like to have someone else holding the animal so that 1, they can't get away from you, and 2, so they can't hurt you or themselves. Here Aisha is holding Puff, so I carefully lift one paw at a time and apply pressure to the paw pad so that all nails are out. Obviously on dogs, their nails are always out, so in this case I'm just doing a feline. So as I apply the pressure, I go nail by nail, cutting it right at the quick, but not actually clipping the quick because it will start to bleed. With cats, I like to use a really small nail trimmer. I cut just the tips off, enough to keep the length down and keep the quicks nice and short. Cleansing ears. When cleaning ears, I also like for someone else to be holding the animal still. I like to always start by using an ear cleanser. Here we're using OtiCleanse. I put it a couple drops into the actual ear canal, and then I like to take my hand and smush the outside of the ear back and forth, and you'll tend to always hear kind of a gushing sound, which is a good sign. Afterwards, I get multiple Q-tips and I start to clean out all of the wax out of the ear that is visible. Make sure that you only use one Q-tip at a time, and each time start over with a new Q-tip so that you're not putting any bacteria or any old dirty earwax back into the ear. Always do this very carefully, especially with an animal who's jerking near their head, because you do not want to do any damage to the inner ear. Applying an Elizabethan collar. When applying an e-collar for any animal, the first thing you want to do is pick the appropriate size e-collar for that animal. You want to make sure that it fits properly, meaning that it's not too loose so they can get it over their head, but also that it's not too tight so that it's uncomfortable for the animal. You want to make sure that they have a collar. I like the breakaway collars the best. You want to make sure that that collar fits appropriately into the e-collar, and then you want to slide the e-collar over their head and onto their neck. It's hard to do this sometimes, especially with dogs that have big floppy ears like a hound or a basset hound. But with a cat, it's pretty simple. Just make sure that you don't get their ears caught in it, because that can be painful for them. You want to make sure that it fits appropriately in length so that they can't reach the site that you don't want them to mess with. So sometimes it needs to be a lot longer, which is hard because then the longer the e-collar, usually the bigger it is around the neck. With Wally, it was pretty easy. He's a really good cat, so he lets you do it. Sometimes it's not that easy, so I always like to have someone holding the animal when I'm putting one on.